listeners. Possibly you're listening to me this evening. It's very short presentation regarding angina pectoris. And when we say angina pectoris, it simply means pain in the heart. Possibly you're listening to me for the first time. My name is Dr. James. I'm a certified natural medical practitioner based in the UK, exactly in London. So today it's a very short presentation on angina pectoris. We want to know what is really angina and then the symptoms, how you identify that. So when we say angina pectoris, it just simply is a type of chest pain that results from reduced blood flow to the heart. A lack of blood flow means that your heart muscles isn't getting enough oxygen. The pain is often triggered by physical activity or emotional stress. Uh, it's quite typical that when you go by stairs or you go uphill, possibly in the past you didn't used to feel that, but now you see a change that when I go by stairs or I do something physical, I have a pain in my heart or I'm short of breath in a way. The classic description of angina is a crushing pain, heaviness, or pressure that radiates across the chest, sometimes down to the arm, into the neck, jaw, and even your teeth, and then into the back. Angina tends to progress slowly over time, and patients may not recognize that their symptoms are due to heart disease. Unfortunately, some patients or people may not have symptoms at all, even with a significant narrowing of their coronary arteries. If you say coronary artery, that's the artery that feeds the heart with blood. So normally when you feel pain in the heart, it means that the coronary artery is about 80-85% plugged or is narrowed by this calcium, cholesterol, and other debris in the blood, because normally the artery wall may be damaged or holes may be made, and your body will fill in these holes. And so, in doing so, up to about 80-85%, the person may start to feel a pain in the heart because there's not enough blood through this coronary artery into your heart muscles. So you begin to experience that pain. We have two types of angina pectoris. We have the stable angina and then unstable angina. The typical characteristics of stable angina is very simple. Normally, it's predictive. It means that you can predict it. Why can you predict it? It means the pain comes only when you are doing something demanding, physically demanding, or you are emotionally stressed out. Typically, when you are climbing stairs or going uphill or doing something that you need extra energy, right? So that is typical of stable angina. And then the unstable angina, here it is unpredictable. You don't need any physical activity to trigger the pain in the heart. So you are at rest sitting in the sofa, and then that individual may have pain, but this pain may last longer, like about 30 minutes, compared with the stable angina. The pain can be very short, few seconds, and then you are all right. But with uh, unstable angina, when you are at rest, you are not doing anything demanding, then you experience this pain, and then it lasts about 30 minutes. And then it means that the condition is really serious. It could be a sign that heart attack is on the way. So you can't ignore this. If you are experiencing anything like that, please just give me a call. If you're calling outside the UK, it's +44 738 464 7300. And you're calling within the UK is 0738 464 7300. So that's about angina pectoris and the symptoms. Thank you very